Regular blood tests monitoring kidney function and potassium levels are necessary when taking spironolactone. Despite these considerations, many dermatologists consider spironolactone an excellent option for hormonal acne, particularly when combined with topical treatments and possibly birth control pills. Lifestyle factors significantly impact hormonal acne. Stress increases cortisol production, which increases androgen activity and sebum production. Implementing stress reduction techniques like meditation, yoga, regular exercise, and adequate sleep improves hormonal balance and acne. Regular aerobic exercise appears particularly beneficial for hormonal regulation. Diet influences hormonal acne through multiple mechanisms. High glycemic foods spike blood sugar and insulin, stimulating sebaceous gland activity and androgen production. Reducing refined carbohydrates and sugar while increasing complex carbohydrates, fiber, and whole foods helps regulate blood sugar and improve acne. Some research suggests dairy products, particularly skim milk, may trigger acne through hormonal pathways. Reducing dairy or switching to hormone-free milk might help if dairy appears to worsen your acne. Insulin resistance, common in women with PCOS, worsens hormonal acne. Reducing refined carbohydrates and sugar, eating regular meals with balanced macronutrients, and maintaining healthy body weight improves insulin sensitivity and can significantly reduce acne. Adding inositol supplementation may help with insulin resistance in some women. Discuss this with your healthcare provider. When to consider professional treatment for hormonal acne. If your acne is severe, widespread, or causes significant psychological distress, see a dermatologist and gynecologist together. If topical treatments haven't adequately controlled your acne after 3 months of consistent use, discuss systemic treatment options. If you suspect hormonal imbalances, irregular periods, excessive hair growth, fertility issues, see both specialists. Guide 8. Natural and evidence-based home remedies for mild to moderate acne. While prescription and over-the-counter acne treatments are scientifically validated and highly effective, several natural ingredients have research supporting their acne-fighting properties. These natural remedies can supplement professional treatments or be used alone for mild acne. Understanding which natural ingredients are evidence-based versus marketing hype is crucial. Tea tree oil is one of the most researched natural acne remedies. Multiple studies demonstrate its antibacterial and anti-inflammatory properties. Tea tree oil kills acne-causing bacteria and reduces inflammation associated with pimples. However, undiluted tea tree oil is irritating and can cause contact dermatitis, redness, and dryness. Always dilute tea tree oil with a carrier oil like coconut oil, jojoba oil, or argan oil before applying to skin. A typical dilution is 5 to 10% tea tree oil mixed with carrier oil. Apply this diluted mixture as a spot treatment to individual pimples using a cotton swab. Don't apply to your entire face, as this may be overly drying. Aloe vera has well-documented anti-inflammatory and antimicrobial properties. Pure aloe vera gel, applied directly from the leaf or as a pure gel product, soothes inflamed acne, reduces redness, and promotes healing. Aloe vera doesn't have the side effects associated with many acne treatments. It won't dry your skin excessively or cause irritation. Apply pure aloe vera gel as a spot treatment or all over your face as a lightweight moisturizer. Most people tolerate aloe vera well, though some experience mild irritation. If you're allergic to plants in the Liliaceae family, lilies, onions, garlic, you might react to aloe. Honey, particularly raw and manuka honey, has antimicrobial, anti-inflammatory, and healing properties. Raw honey contains enzymes and compounds that fight bacteria and reduce inflammation. It's gentle and suitable even for sensitive skin. Apply raw honey as an occasional face mask. Mix a small amount with water to create a spreadable consistency. Apply to clean skin for 10 to 15 minutes, then rinse with lukewarm water. You can do this 1 to 2 times weekly. Some people apply honey directly to pimples as a spot treatment. Honey is gentle, affordable, and many people find it effective for mild acne. Green tea contains powerful antioxidants called catechins that have antibacterial, anti-inflammatory, and sebum-reducing properties. Studies demonstrate that topical green tea application reduces acne severity. Brew strong green tea, allow it to cool completely, and use it as a rinse after cleansing, as a toner, or apply it to your face with a cotton pad. Alternatively, use a face mask or moisturizer containing green tea extract. Many commercial skincare products now include green tea for its antioxidant benefits. Most people tolerate green tea topically well, though those with sensitive skin might experience mild dryness. Zinc supplements taken orally may reduce acne severity, particularly in people who are zinc deficient. Zinc plays roles in immune function, wound healing, and anti-inflammatory processes. Studies show mixed results, but some demonstrate zinc supplementation improves acne, particularly in conjunction with other treatments. Typical zinc supplementation for acne is 25 to 50 mg daily. However, excessive zinc supplementation can cause nausea and copper deficiency, so don't exceed recommended doses without medical guidance. Consult your doctor before starting zinc supplements, particularly if you take other medications. Niacinamide, vitamin B3, is a natural compound with antibacterial, anti-inflammatory, and sebum-regulating properties. While available in supplements, topical niacinamide is more relevant for acne. Many skincare products now include 4 to 5% niacinamide. Studies demonstrate that niacinamide reduces sebum production and acne lesions with minimal irritation. It's suitable even for very sensitive skin and works well alongside other treatments. Azelaic acid, a naturally occurring compound found in grains like barley and rye, has proven antibacterial and anti-inflammatory properties. It's more commonly available as a prescription medication, Azalex, Phenacea, or in over-the-counter products, but azelaic acid is naturally derived. It's particularly effective for post-inflammatory hyperpigmentation and rosacea-related acne. Dietary changes based on research can improve acne. Eating antioxidant-rich foods like berries, dark chocolate, and colorful vegetables reduces inflammation throughout your body, including your skin. Omega-3 fatty acids from fish, walnuts, and ground flax seeds have anti-inflammatory effects and may reduce acne. Increasing fiber intake through whole grains and vegetables improves digestion and may improve skin. Reducing sugar and refined carbohydrates reduces blood sugar spikes that worsen acne. Hydration deserves special mention. Drinking adequate water, about 8 to 10 glasses daily, maintains skin hydration from within, supports detoxification, and promotes overall skin health. While water alone won't cure acne, adequate hydration is fundamental to clear skin. Sleep is profoundly important. During sleep, your body releases growth hormone and reduces cortisol, supporting skin repair and reducing inflammation. Poor sleep increases cortisol, promotes inflammation, and worsens acne. Consistently getting 7 to 9 hours of quality sleep significantly improves skin health and acne. Stress reduction through meditation, yoga, deep breathing, or regular exercise reduces cortisol and inflammation, directly improving acne. Chronic stress is a well-documented acne trigger. Even 10 to 15 minutes of daily meditation or yoga can measurably improve skin. Important limitations of natural remedies. Most natural remedies are suitable for mild acne only. If you have moderate to severe acne, particularly cystic acne, natural remedies are insufficient and you require professional treatment. Natural remedies work best alongside professional treatments, not as replacements. Natural doesn't automatically mean safe or effective. Many natural substances are irritating or ineffective for acne. Finally, natural remedies require consistent use for 4 to 8 weeks to demonstrate effectiveness. Don't expect immediate results. Guide 9. Spot Treatment Mastery. Targeted acne lesion treatment and prevention. Spot treatments allow you to apply potent active ingredient at low concentration, using it 2 to 3 times weekly. After 3 to 4 weeks of good tolerance, assess results. If you're seeing improvement, continue. After 8 weeks, you can increase frequency or concentration if desired. If you're not seeing improvement after 8 to 12 weeks, consider adding a second treatment, for example, adding retinoid to salicylic acid, or consulting a dermatologist. Step 6. Build treatment combinations gradually. Never start 2 new treatments simultaneously. After establishing tolerance to your first treatment, at least 4 weeks, you can introduce a second treatment on different days or in different parts of your routine. For example, use salicylic acid cleanser in the morning, retinoid at night. Start the new treatment at low frequency and concentration, building up gradually. Step 7. Incorporate lifestyle changes. Implement dietary improvements, reduce sugar, increase antioxidants, consider eliminating dairy if it worsens your acne. Prioritize sleep, 7 to 9 hours nightly. Implement stress management, meditation, yoga, exercise, or other stress reduction techniques. These changes typically take 4 to 8 weeks to show skin effects but provide significant benefits. Step 8. Implement professional treatments if appropriate. If topical treatments aren't adequately controlling your acne after 8 to 12 weeks of consistent use, or if you have moderate to severe acne, professional treatments accelerate improvement. Monthly superficial chemical peels combined with your home routine provide excellent results. Professional facials or blue light therapy offer additional options. Step 9. Adjust for your specific factors. If you're a woman with hormonal acne, discuss hormonal treatments, oral contraceptives, spironolactone, with your gynecologist or dermatologist. If you're very acne-prone, you might need slightly more aggressive treatment than someone with occasional pimples. If your skin is sensitive, you'll need to progress more gradually with treatments. Step 10. Track your progress and adjust. Keep a skincare journal noting products used, frequency, side effects, acne status, stress levels, diet, and sleep. After 8 to 12 weeks, assess results. Have you seen improvement? Are side effects manageable? Are you ready to increase treatment intensity? Are you experiencing purging or adaptation? Adjust accordingly. Step 11. Set realistic timelines. Clear skin typically requires 8 to 12 weeks with topical treatments alone, potentially faster with professional treatments. However, residual hyperpigmentation and scarring may require additional time and treatment. Setting realistic expectations prevents discouragement from expecting overnight results. Step 12. Prepare for long-term maintenance. Once clear, continue your core routine indefinitely at maintenance levels. Don't expect to stop all treatments and maintain clear skin. Your skin's acne tendency hasn't fundamentally changed. Maintenance requires ongoing treatment, though frequency may decrease significantly. A sample complete routine for moderate mixed acne. Morning, gentle cleanser vitamin C serum, antioxidant protection, optional, non-comedogenic moisturizer SPF 30+ sunscreen. Evening, gentle cleanser salicylic acid toner or treatment, 3 to 4 times weekly initially, non-comedogenic moisturizer benzoyl peroxide spot treatment on active lesions or retinoid treatment, start 2 to 3 times weekly. Supplements, omega-3 supplementation, possibly zinc supplementation if deficient. Lifestyle, 7 to 9 hours sleep nightly, 30-minute exercise 5 times weekly, stress management through meditation or yoga, diet emphasizing whole foods and reducing sugar/dairy. Professional, monthly superficial chemical peels if available and affordable. This comprehensive approach addresses acne through multiple angles simultaneously. After 8 to 12 weeks of consistent implementation, you should see significant improvement. After 6 months, most people achieve clear or nearly clear skin. After a year, you've developed habits that maintain clear skin long-term. Remember, acne treatment is individual. What works perfectly for one person may not work for another. Patience, consistency, and willingness to adjust are more important than finding the perfect product. Most acne responds to consistent, appropriate treatment. It's a matter of identifying what works for your specific skin and persisting with it. You now have a complete understanding of acne pathophysiology, treatment options, professional treatments, lifestyle factors, and integration strategies. Armed with this knowledge, you can approach your acne treatment confidently, make informed decisions, and achieve and maintain clear skin. Your journey to clear skin is absolutely possible with proper treatment, professional guidance when needed, and consistent effort over time. Commit to the process, trust in evidence-based treatments, and clear skin will follow. 20 Advanced Skin Care and Acne Treatment Guides, Part 2. Each guide, 10 to 15 minutes reading time. Guide 21, Isotretinoin, Accutane, the definitive acne treatment for severe and resistant cases. Isotretinoin, commonly known by its former brand name Accutane, represents the most powerful acne treatment available. It's the only medication that can potentially cure acne permanently. However, its serious potential side effects mean it's reserved for severe, treatment-resistant acne and requires careful medical supervision. Understanding isotretinoin, its mechanism, effectiveness, requirements, and side effects, is essential for anyone considering this treatment. Isotretinoin is a vitamin A derivative, but far more potent than over-the-counter retinol or even prescription tretinoin. It works through multiple powerful mechanisms. First, it dramatically reduces sebaceous gland size and sebum production by up to 90%, essentially eliminating one of the 4 primary factors in acne development. Second, it normalizes follicular keratinization, preventing dead skin cell accumulation that leads to comedones. Third, it has powerful anti-inflammatory effects, reducing the inflammation driving acne. Fourth, it has some antibacterial properties, reducing Cutibacterium acnes populations. The combination of these mechanisms makes isotretinoin extraordinarily effective. Approximately 70 to 90% of patients achieve complete, long-term acne remission after 1 course of isotretinoin. Many patients are cured permanently, their acne never returns. Of those who do experience some acne recurrence, it's typically mild and easily manageable with topical treatments, a vast improvement from their initial severe acne. Isotretinoin's effectiveness is why it's considered the gold standard for severe acne. The trade-off of potential side effects is justifiable when dealing with acne severe enough to cause permanent scarring or significant psychological distress. However, isotretinoin is teratogenic, meaning it causes severe birth defects if taken during pregnancy. This is the primary reason for its strict regulation and monitoring requirements. Any woman of childbearing age must use 2 reliable contraception methods while on isotretinoin and for 1 month after stopping. Monthly pregnancy tests are mandatory. This requirement, while burdensome, has made isotretinoin a reasonably safe option when guidelines are followed. Isotretinoin requires enrollment in the iPledge program in the United States. This program mandates monthly office visits, monthly laboratory tests, and strict documentation of contraception use for women. Prescribers must be registered, pharmacies must be registered, and patients must comply with all requirements. While this oversight seems excessive, it exists to prevent the tragic scenario of a teratogenic medication being used during pregnancy. Typical isotretinoin dosing is 0.5 to 1.0 mg/kg daily, with cumulative dosing targets of 120 to 150 mg/kg for optimal outcomes. A person weighing 70 kilograms might receive 35 to 70 milligrams daily. Treatment duration typically lasts 4 to 6 months, depending on dosing and individual response. Higher cumulative doses correlate with lower relapse rates. Common side effects of isotretinoin include severe dryness affecting skin, lips, and mucous membranes. Lip dryness is nearly universal. Most patients require intensive lip balm use throughout treatment. Dry skin often requires frequent application of heavy moisturizers. These side effects, while uncomfortable, are manageable. Using a humidifier, applying moisturizer multiple times daily, using occlusive lip balms, and using artificial tears for dry eyes all help manage these effects. More serious potential side effects include birth defects, hence the strict contraception requirements, elevated liver enzymes, elevated triglycerides, requiring dietary management or medication, depression and mood changes, inflammatory bowel disease, and rare severe reactions. These serious side effects necessitate baseline laboratory testing, monthly laboratory monitoring, and careful symptom assessment. Any concerning symptoms should be reported to your dermatologist immediately. Depression and mood changes are particularly concerning.
Welcome to this gentle healing space. Take a slow, calming breath. Today we're exploring how to reduce acne marks over time, those stubborn spots that remain after breakouts heal. With patience and gentle care, these marks can fade significantly. Acne marks, also called post-inflammatory hyperpigmentation, or PIH, are dark spots left behind after acne heals. They're not scars. They're areas where inflammation triggered excess melanin production. The good news is that these marks are temporary and will fade on their own, though you can support and accelerate this process. Understanding the difference between marks and scars is important. Acne marks are flat discolorations, brown, red, or purple, depending on your skin tone. Acne scars involve textural changes, indentations, raised areas, or tissue damage. Marks fade with time and proper care. Scars typically require professional treatment. Today we're focusing on marks. The most important step in reducing acne marks is preventing new ones. This means treating active acne gently to minimize inflammation, never picking or squeezing pimples, which increases inflammation and darkening, and protecting your skin from sun exposure, which darkens marks significantly. Sun protection is absolutely crucial for fading acne marks. UV exposure triggers melanin production, making marks darker and slowing fading dramatically. Wear broad-spectrum SPF 30 or higher every single day, even when indoors or when it's cloudy. Reapply if you're outside for extended periods. Without consistent sun protection, other treatments will be far less effective. Now let's discuss treatments that support mark fading. Several ingredients have been proven to help fade hyperpigmentation safely and effectively. Vitamin C is a powerful antioxidant that inhibits melanin production and brightens skin. Use a serum with 10–20% L-ascorbic acid, the most effective form. Apply it in the morning under moisturizer and sunscreen for antioxidant protection throughout the day. Be patient. Vitamin C takes several weeks to show visible results. Niacinamide reduces inflammation, which prevents marks from forming and helps fade existing marks by inhibiting melanin transfer. A serum or moisturizer with 5 to 10% niacinamide can be used twice daily and works well with other ingredients. Alpha hydroxy acids like glycolic or lactic acid exfoliate surface layers, encouraging cell turnover that gradually removes pigmented cells. Start with 5 to 8% concentration 2 or 3 times weekly. As your skin builds tolerance, you can increase frequency. Always use AHAs in the evening and be diligent with sun protection the next day. Azelaic acid addresses both active acne and marks simultaneously. It has antibacterial properties and inhibits melanin production. A treatment with 10 to 20% azelaic acid can be used once or twice daily. Retinoids accelerate cell turnover, bringing fresher, less pigmented cells to the surface while preventing new pigmentation. Over-the-counter adapalene or prescription tretinoin used consistently over months significantly fades marks. Start slowly, 2 to 3 times weekly, and build tolerance. Always use retinoids at night with thorough sun protection the next day. Kojic acid, licorice root extract, and arbutin are natural ingredients that inhibit melanin production. Look for serums containing these ingredients. They're gentle and can be used daily. Tranexamic acid is a newer ingredient showing promise for fading hyperpigmentation. Products with 2 to 5% tranexamic acid can be incorporated into your routine. Layer these ingredients thoughtfully. A common effective routine: morning, vitamin C serum, niacinamide moisturizer, sunscreen; evening, cleanser, AHA or retinoid, niacinamide moisturizer. Don't use all actives at once. Choose 2 to 3 that work for your skin and use them consistently. Rotation works well. HA one night, retinoid the next. Rest day, repeat. Be patient. Acne marks take time to fade, typically 3 to 6 months for significant improvement, sometimes up to a year for complete fading. Consistency matters more than intensity. Gentle, regular use of effective ingredients will fade marks over time. Professional treatments can accelerate fading if home care isn't sufficient. Chemical peels performed by professionals provide deeper exfoliation. Microneedling stimulates collagen production and can help fade marks. Laser treatments target pigmentation specifically, but can be expensive and require downtime. Discuss these options with a dermatologist if you're interested. Professional treatments combined with good home care give the best results. Lifestyle factors affect mark fading. Manage inflammation by reducing stress, getting adequate sleep, eating anti-inflammatory foods, and staying hydrated. Less inflammation during healing means less dark marking. Be extremely gentle with active breakouts. Never pick or squeeze. This dramatically increases inflammation and resultant dark marks. If a pimple needs draining, use clean tools, minimal pressure, and immediately apply spot treatment. Keep your skin well moisturized. Healthy, hydrated skin repairs and renews itself more effectively than dry, compromised skin. Certain skin tones are more prone to post-inflammatory hyperpigmentation, particularly darker skin tones with more melanin. If you have darker skin, be especially vigilant about sun protection and gentle acne treatment. The principles are the same, but the importance is amplified. Avoid harsh treatments that could cause more inflammation and thus more marks. Be cautious with strong peels, aggressive exfoliation, or irritating ingredients. Gentle, consistent care works better than aggressive treatment for fading marks. Understand that complete fading takes time measured in months, not days or weeks. Set realistic expectations. Significant lightening in 3 to 6 months is success. Don't expect miraculous overnight results. They don't exist. Take photos monthly to track progress. Day-to-day changes are imperceptible, but monthly comparisons show the gradual fading occurring. Stay consistent even when progress feels slow. The treatments work cumulatively. Every day of gentle care, sun protection, and appropriate treatments is contributing to fading, even when you can't see immediate results. As we close, remember, acne marks are temporary. With patience, protection, and gentle encouragement through effective ingredients, they will fade. Your skin knows how to heal and renew itself. Support it consistently and trust the process. May your marks fade gently and completely. May you have patience for the healing timeline. May your skin become clear and even. Thank you for this time together. Trust the fading process. Welcome to this caring moment. Breathe deeply, feeling your body relax. Today we discuss caring for your skin after pimple extraction, how to support healing and prevent scarring after a blemish has been drained. Sometimes, despite our best intentions not to touch breakouts, a pimple comes to a head and needs to be drained, or you've had professional extraction. Proper aftercare is crucial for healing without infection, inflammation, or scarring. First, understand what happens when a pimple is extracted. Whether open naturally or manually, extraction creates a small wound. The protective skin barrier is breached, leaving the area vulnerable to infection and inflammation. Your immediate care in the hours and days following extraction significantly affects healing outcomes. Immediately after extraction, the priority is cleanliness and protection. If you've just extracted a pimple at home, immediately cleanse your hands and the affected area with gentle cleanser and lukewarm water. Pat dry very gently with a clean towel or tissue. Apply an antibacterial spot treatment. Benzoyl peroxide at 2.5% kills bacteria that could infect the open pore. Alternatively, use a spot treatment with salicylic acid or a dab of antibiotic ointment. Apply carefully just to the extracted area. Consider applying a hydrocolloid bandage or acne patch over the extracted pimple. These serve multiple purposes. They protect the wound from touching and bacteria, absorb any remaining fluid, create a moist, healing environment that reduces scarring risk, and prevent you from touching the area again. Leave the hydrocolloid patch on for several hours or overnight. When you remove it, you'll often see that it's absorbed additional fluid, continuing the clearing process. For the first 24 to 48 hours after extraction, be extremely gentle with the area. Don't apply makeup over it if possible. Don't touch it. Don't pick at any scab that forms. Scabs are your skin's natural bandage, and removing them increases scarring risk. Cleanse your face gently once daily, being extra careful around the extracted area. Use your regular gentle cleanser with fingertips only. Pat dry carefully. Continue applying spot treatment and/or hydrocolloid patches until the area has closed and begun healing. This typically takes 2 to 5 days depending on the size and depth of the original pimple. Once the wound has closed, usually after a few days, you can begin supporting healing and preventing scarring. Keep the area well moisturized. Hydrated skin heals better and faster than dry skin. Apply your regular moisturizer over the healing area. Protect the area from sun exposure vigilantly. UV radiation can darken healing skin, creating post-inflammatory hyperpigmentation that lasts for months. Apply sunscreen carefully over the area every day. Consider using a zinc oxide-based spot treatment that provides both sun protection and healing support. After a week or so, when the area has healed over but may still be red or dark, you can begin using ingredients that support scar prevention and fade any darkening. Vitamin C serum helps brighten post-inflammatory marks and supports collagen production. Apply carefully to the healing area once or twice daily. Niacinamide reduces inflammation and helps prevent excess pigmentation. A serum or moisturizer with 5% niacinamide can be applied to the healing area twice daily. Once the area is fully healed with intact skin, usually after 1 to 2 weeks, you can carefully use gentle exfoliants to help fade any remaining mark. AHAs like glycolic acid at 5 to 8% concentration used 2 to 3 times weekly help remove pigmented surface cells. Retinoids support cell turnover and collagen production, helping heal marks faster. Wait until the area is completely healed before applying retinoids, then use them carefully 2 to 4 times weekly. What not to do after extraction. Don't pick at scabs or peeling skin. This dramatically increases scarring risk and can reintroduce infection. Don't apply harsh treatments hoping to speed healing. Aggressive products cause more inflammation and delay healing. Don't cover with heavy, pore-clogging makeup immediately. If you must cover it, use light, non-comedogenic mineral makeup and remove it thoroughly in the evening. Don't expose healing skin to sun without protection. This causes dark